nursing as a degree occupation is generally in the top 5 of all degree occupations in almost every state in the United States. So when we look at demand needed, as well as the mismatch between what nursing schools produce on an annual basis and the number of openings, that's sort of fundamental mismatch in the range of tens of thousands of nurses annually. We don't really see a place where that gap is going to be significantly closed. And while I don't have a good sense of how much, technology may shift that curve to reduce the numbers of what's needed, the supply demand imbalance, at least in nursing, is so dramatic right now that it's hard to imagine we'll be at a place where that disappears anytime soon.
So, what have you been doing at Social Finance to work with? I think you're working with educators and employers.
That's right.
I'll let you put it in your own words, but what have you guys
Sure.
been doing to help that situation?
Sure. Yeah, we really think about, I like to talk in terms of, kind of anecdotes or imagery. And Ramon, I really think about the imagery this way. We're really at Social Finance trying to build two bridges. And both of these bridges are in service of learners, historically underserved or marginalized learners. But bridge number one is to get learners into nursing school and into a high quality program. And we do that by offering affordable, student friendly, and I can talk about what that is, but the most student friendly financing that we can to get them into a nursing education. Now, why do we want to do that? We want to do that because we know for folks who need a better job that nursing is both, as I just mentioned, high demand, and in terms of economic mobility, we can see a before and after of program participants in which a pre-program wage, maybe in the high 20s, $30,000 for adult learners, can approach $80,000 post education. So the before and after for us in terms of serving learners is quite dramatic into getting people into a better job. So bridge one is get them into school, help them persist through school, help them graduate and pass the NCLEX. Then bridge two, Ramona, is how do we actually then just make sure we get them into that high quality nursing job? For if we fall down at that point after graduation, then we really haven't closed the loop. We haven't, met the mandate that we have, which is creating a better job. Now, to get them into over bridge two, we naturally look at the highest demand places where employers have the highest talent needs and frankly are willing to invest in the workforce to bring them in because we're solving a problem for them that they feel like they can't solve on our own. In social finance's case, that means ideally that employer will repay us for financing that we've put out upfront as a mechanism of both attracting and retaining that worker over time. And we have a couple of different models that I oversee that both focus on that same creation of two bridges into school, successfully through school, and into employers, with employers ideally repaying that financing that we've put out front. For us, Ramona, that's the best way to close that cycle for the learner from pre-program to great job, and hopefully in the most affordable way possible, which is an employer that's valuing them and repaying that on their behalf.
And how does this affect the student? Do they have any costs at all?
Yeah. So for the student, the way it looks for us is you would basically end up. So one of the funds we oversee is called the Renew Fund. Our educational partner there is Western Governors University. And we support the third and fourth year in terms of financing of a Bachelor of Science in Nursing degree. It's a 4-year degree. WGU is competency based online, but in years 3 and 4, students have to go to clinical rotations. They go to labs at WGU simulation centers in those 2 years. And with WGU's adult learners, in particular, we finance those years 3 and 4 because we know that more traditional nursing education is very hard for an adult learner to work at that time. Whereas in years 1 and 2, when they're working on their prereqs, it's easier for an adult learner to hold down a job and work at the same time. So the way it looks for a student is we loan them, and we by the way, Ramon, it's important to point out our eligibility criteria for new is Pell eligible students. Again, for us as a marker of trying to avail preferential financing to those students who need it most. And in this case, we've used Pell eligibility as that marker. It looks like to the student a 0%, zero fee loan. And so they take out that loan for the total cost of attendance, both tuition and fees, net of Pell, as well as supporting additional things like travel to the labs and so forth and so on. So total cost. And then, really, when you think about that bridge too, ideally, we want our learners to have two choices once they've graduated and passed the NCLEX. Choice one is they just pay back a 0%, zero fee principal only loan over 5, 7, or 10 years. Anyone you've talked to who's gone to nursing school, if you talk to a nurse and they've borrowed money, they always say to us, sort of like, "Oh my gosh, where was the 0% loan when I went to school?" Because we all know that student debt typically is not priced at 0%, certainly in today's environment. But secondarily, this is the part with the employer network and where we'd like employers that we can, students that we can place with employers to pay us back that financing, typically for a retention time frame of 3 years. So it's a shorter time frame. But at that point, the employer will have paid back all of that financing on behalf of the student. The last thing I'd say, Ramona, is in that kind of model, when I talked earlier about wanting to be student friendly, what I mean also is that we want to make sure that student has downside risk protection. Indeed, one of the key challenges in student lending, of course, is taking out student debt, not graduating, or not getting a job. In the case of a nurse, not passing the certification exam, and yet having the debt and no job. Now we've left a person measurably worse off. In the case of the Renew Fund, what we do is if the student doesn't graduate, doesn't pass the NCLEX, or does not get a nursing job making at least $60,000 a year, they actually do not have to pay us back. We don't want to leave students worse off.